this one, I know Kim, you had asked me to do a second session, which I was, certainly more than happy to do. You don't ever have to convince me to talk. And this one, is a little bit of a, I sort of wanted it to be a little bit of a discussion, because I know the number one thing really impacting EMS agencies right now is workforce. In fact, probably more so than just about any other aspect in an EMS agency. And, given that it is, as we talked about in the last session, anywhere from 57 to 70% of your overhead, we often will see that, what's been happening in the last few years. I know when I originally contracted with the AAA 6 years ago, I had been carrying the workforce as the single biggest challenge facing EMS agencies in this decade. And, as many know, the main focus of AAA has always been really geared towards reimbursement and advocacy on behalf of EMS agencies. Well, we are now, I would say, nearly all of the work that I see done right now by the AAA, or at least a significant portion of the work is being done, is really being geared at workforce related initiatives. And so, all of which ultimately really do tie back to reimbursement in some way, shape, or form. But I think, as we talked about in this last session with cost data collection, one of the challenges EMS has always had, and this is one of the things that I've seen Matt really do very, very well, is in producing data and information. Because without data and information, everything else sounds and looks a lot like just an opinion. And we already know the saying about opinions. In any event, so again, I want to thank you all for inviting me back for a second one. And I know many of you, I've been an EMS guy for 31 some odd years, an employment attorney for 18 years, and a call firefighter for 16. But for the last 6, I've principally worked in my own consulting and law firm, and my largest client happens to be the American Ambulance Association, although I have a bunch of other clients outside of that. And I, frankly, have been spending much of my time over the last year and a half, 2 years, really trying to sort of steer my business more towards the workforce side, as that is clearly becoming the bigger issue. So just quickly, always say, trust a lawyer who's going to tell you not to trust and to rely on what they're about to tell you. This is just an educational program. And so if anything in here looks like legal advice, it's not. It's really educational advice. And if you have or need legal advice, you should consult an attorney who's licensed in your area. Certainly always more than willing to answer any questions, but most times, if in fact there is something that I think you really do need to consult with an attorney licensed in your area, I will tell you so. But as I say to any person who has the fortune or misfortune of getting to sit through one of my sessions, is Kim, and I think Tim can attest to, certainly I always say you can call anytime, with any question, and I will do my damnedest. If I can't answer it, I'll find out the answer and I'll get back to you. So the goal of today really is to talk just quickly about the importance of having a recruitment and retention strategy, and some of the practical steps that providers can do regardless of your size that impact recruiting. We'll talk a little bit about employer branding, which you may or may not have heard before, but certainly employer branding, and the importance of first impressions, because sometimes that's the only impression you get to give, and then career laddering and career development, and the impacts that has on your retention rate and your recruitment opportunities. And then performance feedback's role in retention. And then a little bit, I had actually pitched to Kim that maybe, geez, I know this is a financial conference, but one of the biggest issues facing EMS organizations right now, and literally what I feel like I've become a pandemic lawyer, as I said in the last session, I'm spending probably 90% of my time dealing with some of the mandatory vaccination related issues that are now facing EMS providers. So I'm happy to answer questions really on any of that at any time. And as we did in the last session, just either raise your hand or let me make sure I bring the chat and the Q&A up as well. I will leave both of those open, and I will address questions that come up during the session. So why is it critical to have a recruitment plan? Well, it actually, and I don't know how many of you all there, for years and years and years, most folks just went up and posted something on their website, and applications used to come in, and it was a pretty passive process. and it didn't have to be all that intentional, right? But nowadays, what we know is without, and this is true really in every aspect of management, without a systematic approach, without a plan, you are planning to fail. So you need to have a systematic approach to talent acquisition. This goes beyond just hiring, right? You need to think about the fact that if what I always say that the employment relationship is no different than any other relationship that you have in your life, whether it be a marriage, a friendship, any other relationship. And frankly, what you need to recognize as an employer is that you need to think about those relationships very similarly. In other words, put the same efforts into the relationships that you have with your staff, your employees, and the people who make them work for you, as you do into your friendships and marriages. And one thing that we do know about both friendships and marriages, many of us have those friendships that you don't have to talk for someone. You might have had a best friend growing up, you don't have to talk to them, and after 10 years you can get together and it's like nothing ever happened. Well, the only reason that actually works is because you had invested so many years on the front end of that, developing the relationship and the trust and the respect that you can go 10 years without talking to them and then get right back together with them. But in most employment situations, we take that for granted and we just expect that we more or less can hire someone in and after that, let them go on their own. And then, we touch base with them once a year when we do performance related information. And we're shocked why people haven't developed a sticky, really, great relationship with our organization. So without a recruitment plan, by the way, your results are absolutely going to be inconsistent. So some folks ask me, is this an actual document? I'll tell you, the more formal your process is, in other words, the more formally that you think and approach recruitment and retention, the greater likelihood is that it is a thing in your organization. It will get thus what's get measured gets managed. And of course, part of that is in having the plan. Now, both are critical, both recruitment and retention, because I have had and recall in my times working at a very large ambulance service, almost 1,200 employees here in the Boston area. The owner of the company said, geez, HR is not doing anything about the 180 open full-time positions we have at this organization. And I said, I don't know what you're talking about. We hired 236 people last year. And he said, well, we lost 235. And I said, well, HR alone does not keep 235 people from quitting a company. That's something far bigger. So I can keep filling that bucket, but if it's got a lot of holes in it, we're not going to make any progress. And as a result, we're burning through a ton of money. You all have seen the studies, including the AAA's HR turnover or their employee turnover study. And what we know is, and this is really, 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 really understated, is that it cost at least $10,000 basically to onboard somebody. We're not talking about the cost of turnover. That, generally speaking, in all HR fields, says that is roughly 3 times the annual salary of any individual. Now, looking at your own employees, by the way, is the single biggest way that you are going to drive real recruitment results. Nobody cares if on your website it says we're a great competitive company with wonderful benefits. Everybody says that you're a great competitive company with wonderful benefits. But what I will say to you is the number one place that most people get jobs is through social media, number one, and then number two, through recommendation by people who work for you. Recognize that right now, if you were to query your staff, what percentage of those people would say that you are a great place to work? All right. What we know from all of the studies regarding recruitment and retention is that the sort of number 1, 2, 3, 4 things that really impact more than anything else are the feeling of job security, salaries and benefits, work-life balance is, and by the way, we in EMS are not known to have a great work-life balance. And then of course, location. Location, that's across, by the way, in recruitment and retention, that's really across all industries. I would argue that location is a lesser or a lower driver in EMS. But those first 3, job security, salary, benefits, work-life balance, what we know from years and years of Gallup surveys, and that's probably 2 decades now, is that the number one thing that impacts employee engagement in an organization is the relationship that individual has, the employee has, with the person they identify as their immediate boss. Now, if you guys are like most of the ambulance services that I've seen, the typical frontline supervisor spends very little time actually engaging, coaching, and mentoring employees. The only research I could find was in retail. And the retail says that your average frontline supervisor spends about 6 to 8% of their time coaching, mentoring, and engaging employees. 6 to 8. That's when everybody's in the same building, in the same box. And so I bet you in EMS, it's probably 2 to 3%. That being said, recognizing how much time and energy you spend on educating and developing your leadership staff, in particular, your frontline leadership staff, those are the folks that drive your recruitment and engagement. Next to your employees, those are the folks that drive that more than anybody. So how do we reach the people that we want? One of the things that I ask folks all the time whenever I do any consulting on the HR side is, what is your employer brand? And what's the employee value proposition that you offer as an employer? And so really, what is an employer brand? It's that attributes, qualities, organizational characteristics, right? Promises that you make to the employee about what it means to come work at your organization. Every single company, EMS agency, every single employer in the country has an employer brand. Whether you're aware of what that employer brand is or not, you have one. And one of the ways that you can kind of learn what your employer brand is to go on Glassdoor. It's www.glassdoor.com, and plug in your company's information. Glassdoor is a website, many of you probably already know it, that where your employees can go and anonymously post feedback and reviews about working for your organization. That, by the way, is one of the places that if you're not aware of, you should be monitoring that website on a daily, weekly basis for sure. All right. So why should someone come and work for your organization? And many of you have heard me say this before. I asked that same company when the guy said, hey, 235 quit. I said, well, why in the world should someone come work for you? And he said, what do you mean? I said, why should anybody come work at this company? And I said, he said, well, we're big. And I said, well, honestly, AMR is big, Walmart's big. And he said, well, we have great equipment. I said, yellow stretcher, red stretcher, Philips monitor, X series, really, no one cares. It's all the same. He's like, well, we do a lot of 911 work. I said, I promise you, you don't do more than the fire department or the police department. So why should someone come work for you? And once we got through all of that nonsense, because basically, I don't know if you know this, most people put people on stretchers roughly the same as the people in the service next to them. So why should someone come? It's that set of attributes, that thing, that feeling that people get. It's what you offer beyond the vehicles and all of that stuff. Because at the end of the day, vehicles are nice, vehicles matter, of course, but pretty much everybody's got pretty much the same equipment and the same stuff. You're all pretty much doing roughly the same kind of calls, either 911 calls or non-emergency medical transport. MATS, of course, as we know, has developed a lot of opportunities for people. That comes back to one of the things that I'd say MedStar has done very well, which is developing a career ladder, an opportunity for folks to look at what it means to go work for a company and what their future could look like should they decide to stay there. In other words, it's more than just you should come work here until basically we eat you up and spit you out. We're going to offer you an opportunity to make a living for a lifetime. So what is an employee value proposition? Well, really, that communicates to the candidates what they can expect from you as an employer. Again, remember, when somebody comes in to interview with you, there is an interview occurring on both sides of that table. And nowadays, in particular, I think employers are becoming acutely aware of the fact that employees have an option of where they go. And, I have several clients who when they started to really take a hard look at their turnover, what they found was all of these additional pay programs that they've been doing, adding bonuses and stipends and all of that stuff, has not really impacted their turnover almost in any way, shape, or form. At the end of the day, it's going to come down to culture. So the other thing about an employee value proposition is it really tells tells the people who work with you, including your own supervisors and leadership, what you aspire to be as an employer. And so one of the things that I often say to employers who argue that they have a low level of employee engagement or a morale problem is that you probably should look to your frontline leadership, because oftentimes that's where most morale related concerns and employee engagement concerns come. We put people into these positions and provide them with virtually absolutely when anybody thinks about being a leader or thinks about being a supervisor, I guarantee you the first thing that they're thinking about is coaching, mentoring, and having an impact on their fellow coworker. I promise you, it is probably not 90% of what you have them doing. So I understand that work has to get done. But again, your staff will see what you value based upon how you allocate the resources in your organization. So 5 questions. Why should someone come work for you? You should ask your own team these questions, in particular, your leadership team. Start there and then work your way out. What percentage of your supervisors have received training on how to deliver a brand experience? In other words, when you're training your staff or your supervisors, to what extent are you talking to them about making sure or ensuring that the employee, right, that you're talking about what the employee experiences? This is not some stick a daisy down the end of the rifle kind of stuff. At the end of the day, people quit organizations based upon how they feel about working there, not almost anything else. So understanding what training, to what extent are your supervisors working to ensure that the experience that the employee has, that they are impacting in the best possible way that they can, the experience your employee is about to have. What is the perception of your employees and candidates? Ask your employees, but by the way, don't get ticked off at them when they tell you. Ask your employees what it means to work. What is your employees' perception about what it means to work at your company? By the way, Glassdoor, again, a good place to look, but ask your employees what it means to come work there. What level of visibility do you have of your entire employees in your talent pool? In other words, to what extent, if you ask yourself, I often hear leaders say, we have an open door policy, and I call BS on that, because an open door policy relies on your employees taking the initiative to come upstairs and go into your executive office, or make an effort to reach out. By the way, you are making them reach out, not you reaching out to them. Again, you're pushing them to the door. Open door policy is intended that you might accidentally fall out of that office every once in a while. I know leading ambulance services is tough. I was the CEO for a service, roughly a $20 million annual revenue. We did a lot of calls. And what I would say is, at the end of the day, I am well aware of how difficult it is. What I will suggest is, this is the kind of thing that will not get better unless you focus on it. What percentage of your employees would recommend your place as a great place to work? This is stuff that you should be finding out, that you need to work on. So have you developed a plan? Well, how do you do that? That's actually pretty straightforward. And by the way, this is the kind of thing that seems like a nice touchy-feely thing to do. But what I will say is, you will 100% bear the benefits if you tackle or take on this initiative. So 1, getting together your stakeholders. Who are your stakeholders? Well, they're not only your own supervisory and management staff, but of course they're your own staff. Some stakeholders may even be, geez, what do my employees' family think about what it means to work for this organization? The strangest thing in the world, if you surveyed your employees' families, you might give your employees the unusual or unexpected idea that you give a crap about their family as well, and the impact their job has on their family. My fire chief, we were a call fire department. We did get paid, but we were a call. At every holiday party, would have the firefighters stand up to acknowledge them and then sit us down, and they would say, now the really important people are the families. Again, your stakeholders are more than just the people who work at your company. They can be your contracted partners, they can be your fire departments, but primarily, by the way, they can be your employees' families. Fact finding or research. You need to be doing research into, by the way, if your education and training is tied around system status management and clinical stuff, I've got news for you. 85% of what occurs at an ambulance service day to day has nothing to do with clinical medicine. And if you're going to look into what experience your employees have every day, you need to get past whatever cardiac monitor you have or whatever stretcher you have. That is part of the experience. But as I argue, the minority of the time your folks spend actually working is spent performing actual clinical medicine. You need to think about the other aspects of the job that impact their day-to-day experience. Set goals for the employer branding project. Make them simple, make them definable, and make them attainable. If you have some pie in the sky idea that you are never going to hit, guess what? It is going to get dismissed very, very quickly. You need to do, again, research once you've decided what those goals are, understanding what tools do I need to get there, what's the best way to get there, assigning tasks or champions. Just like with cost collection, just like with accreditation, Just like if you decided to take on an MIH program, you would assign a champion. You do need a champion in this instance. And again, a number two who can pick up and run with the ball should your champion move on. Set deadlines. One of the biggest mistakes I ever see with folks are they implement a project without any definable deadlines or delivery dates. One of the things that my boss at the United States Department of Labor used to do was set up a monthly meeting with me to go through all of my my various projects at the time to make sure that I was meeting my deadlines and doing work. By the way, the meeting itself was what 9 out of 10 times made me make sure I was on track. Determine what measurements or what metrics you were going to use. By the way, if you don't identify what those metrics are and clearly define them within your organization, you are again setting yourself up for failure. And then going through that monitoring and timeline. So communications plans, all right? You need to have, by the way, public relations. And I got in a little bit of hot water with a marketing person for an ambulance service when I first started presenting for the AAA, because I said, I don't believe ambulance services should burn a lot of time on going to visit hospitals and nursing homes and all that stuff. Because truthfully, the number one folks who do more marketing for you than anything else are your own staff. So you should have and develop a great plan. This goes back to that Richard Branson, which is you take care of your people, you train them and take care of them so that they can leave. And they, by the way, are less likely to leave you because you put them in a position where they can go. So make sure that you have both an internal and an external. If all of your efforts, your website, by the way, no one goes to your website to see if they should buy your ambulance, you use your ambulance services. The only people going to your website, maybe if you bid on a contract, they're going to look at it to make sure you're an actual legitimate ambulance service. But truthfully, the only people who go to your website are potential employees or your own employees, more likely potential employees. So your website should speak to those individuals. Do not have canned pictures of other people. It is so darn easy these days to take great pictures. Your pictures should be of your own staff. Your pictures should make sure that you're showing what your staff does. Matt and MedStar, I got to give them credit, and I don't mean to be blowing a lot of sunshine, but honestly, they do a fantastic job at making their organization look fun to work for. If I lived in the Fort Worth area, I would try to get a job there. I'm not sure they'd have me, but I would try. There is no one size fits all, right? In other words, recognizing that not everybody's a 22-year-old EMT that wants to come work for your company, right? There may be folks who are in different aspects or different places in their life, married folks, single parents, people who have, just had children, maybe people who have retired from the principal job, but want to do non-emergency, transport work, whether that be wheelchair or dispatch or education. Recognize that one size messaging will get you one result. What you need is to segment your message to hit the various types of people who might come to your work. This is the kind of thing where you might consider talking with a public relations person or a recruitment firm. Truthfully, this is stuff you can do on your own. And honestly, with the way social media and marketing are these days, you really can segment your ads or your outreach to people based upon who you're looking to meet. We did a webinar a couple of weeks ago with Kathy Fredrickson, who is the head of digital marketing at the University of Wisconsin. And she said, heck, you can even set up parameters so that if somebody applies at your competitor, when they get certain, within a certain distance or geo distance away from those, you can ping an ad that they work here. That feels a little creepy to me, but just you can do it. All right. The importance of, again, one last thing on that, different messages for different candidates. Keep in mind that not everybody is a 20-year-old millennial or even our next generation. I understand, by the way, despite popular belief, millennials are, by the way, your average millennial now is in their late 20s, and there are millennials as old, in their 30s, right? So in other words, people who have kids and have homes. So let's stop pretending like they're the folks who don't want to commit to anything. What I'd say is recognize that at different stages in their life, people are looking for very different things. Me as a 52-year-old EMT, I would love to go work a shift where I just do like 5 or 10 interfacility transports over a course of a shift, where I'm not going to be carrying a 300-pound person down a flight of stairs. To me, that appeals differently. So recognize that you have a bunch of different messages to a bunch of different people. One size does not fit all. Social media, you should have one person, at your organization really who takes charge and also encourages your own employees to post messages and to be active in social media. That is where 67% of job applicants go now to take a look at what it's like to work at your company. 67%. So you should consider making sure that you have an active social media presence. Again, I got to shout out to MedStar. They do an outstanding job at it. And then your job postings, by the way. I always love seeing people put, we have competitive benefits. Everybody's going to say they have competitive benefits. Be specific. Say what it is. By the way, most people know what your pay scale is. So it's not like you've got the secret sauce. I'm not trying to be insulting, but what I'm saying is be different, because in a world of ambiguity, specificity looks really attractive. So what I would say is be different. Your jobs page, what does it look like, right? What does it take? What does your job posting convey? Is it just your job description? And again, is it really clearly stated what you're offering your employees? Job description is an ad, right? It's an ad. Your jobs page should be updated regularly. Do not have a posting that is sitting out there every single day for 365 days a year, despite the fact that the job may still be open. People want to see new postings coming up. Set your social media so that you can update your jobs page, and it pops something out to the web. This is stuff that, while it seems really tedious, it's very, very important for you to do these things. Very, very, very simple. All right. Applications, mobile friendly. If you have never tried to fill out, I have once, the same boss, I'm beating up on him a little bit. He's a great boss, but he said, where are all the HR people? We had 4 people in the HR department, myself included. And once a month, we went out to every single station, and we would, sit and talk with employees, what we called employee-based meetings. One day he came in and all the HR people were out, and he said to me, Scott, where is everyone? I said, we're at base meetings talking with employees. And he's like, what if someone comes in to apply for a job? And I laughed I was like, comes in to apply for a job? Are you kidding me? No one walks in the door anymore and fills out an application or looks for the sign on it. No one does that. And he was like, what do you mean? I said, no one does that. We haven't received a walk-in application in 4 years. Why in the world are you still talking in a UHF way when you're talking like LP when we are way past CD or MP4 or any of the technologies, right? Actually, we're now back at LP, by the way. So what I would suggest is your job applications should be mobile friendly, should take less than 1 to 5 minutes. Something like 87% of job applications get abandoned if they're longer than 1 to 5 minutes. All you're really looking to do is to get somebody on the phone with you, right? You do not want to make it hard. Do not make them put out where they went to college. Do not make them put where they took their EMT course. What do you care? You're going to interview them anyways, hopefully. What you're looking for is to hook people to come in and for you to get them on the phone. You do not need to know what high schools and all of the other jobs they worked at. You can get that. You just want to get their interest on the phone, get you on the phone with them, and you can get the rest of that information. You want to make it easy. Try applying yourself. Often when I do consulting work or someone hires me in to help them with this, one of the first things I do is apply for a job and see how long it takes to get a response. There are lots of tools you can use to make this super easy. In fact, even some bots you can use that will then respond back really, really quickly. If you go to the AAA page right now, there is a quick chat that pops up and says, hey, what can I do to help you? Again, use technology. By the way, they are using technology. And so you should be doing so too. Talk in a language they understand. If you go on your application on your mobile device and it is not also designed for mobile, you are setting yourself up for failure. You will find out why. Pretty much, as I think I've joked before, my daughter sends me a text from the other room to bring her water, right? Most younger folks today want to communicate via phone or use their mobile device. They're not even using laptops half the time anymore. Time to interview, you need to be measuring what's the amount of time in days or in hours it takes you to schedule an interview after somebody who is otherwise qualified, or even if you're not sure if they're qualified, what would it take for you to get them on the phone on a video chat? I would not do phone calls, right? But understand, again, oftentimes folks want to do text message. Lots of organizations are using text message communication with job applicants. And then at some point, yes, they are getting them on a video chat. But how long does that take? I can promise you, if it takes you more than one day, you are losing people because of that alone. Unless you, by the way, operate in an area where there is no other game in town, just for the record. If there is no other game in town, well then, you're pretty lucky. But just understand that doesn't mean you shouldn't still make it super, super easy. The last thing you want to do is make somebody have to climb a huge high wall to get into your place. A better metric is really time to hire, right? Because again, time to interview is you're going to interview some folks who you may not hire. Time to hire really tells you how much time does it take us to, when we get an application from someone, till we actually get them in the door. What I can tell you is that time needs to be as short as humanly possible. I'm not suggesting that you shouldn't vet these people. You absolutely should vet them, but recognize that we're not in a day and age where you can take 2 to 3 weeks to get someone through that process. And a good recruiter, right, needs to be able to convert 75% of the quality employment applications and get them in for a scheduled interview within 5 days. Again, I just have to tell you that one of the things that I will say on an interview is, if you do designate certain days in which you're going to do interviews, that's fine. What I would say is remain on time. When they walk in the door, do not leave them sitting out in your lobby for an extended period of time. Generally speaking, don't interview them in your office. That is a terrible place. Take them to, if you have a conference room, that's really where you should be doing it. By the way, they are drawing judgments. And if many of you are like some of us here in the building, you may or may not have a bunch of stuff on your desk. That leaves them with an impression as well. So it's important that you recognize that you're trying to professionally date this person. So you should make sure they are judging you as much as you might be judging them. No differently if someone walked in looking like they just rolled out of bed in a pair of torn jeans and looked terrible, you probably would be less likely to hire them than if they came in and they hit it out of the park. Onboarding and orientation, first impressions. When someone walks through the door, everyone should know who they are, by the way, because you should have sent something out ahead of time to tell your staff that people are coming in. Number 2, don't leave them sitting there again for a long period of time. Don't act like, oh my God, yeah, that's right, you're starting today, by the way. You're already on the wrong side of that. Act as if you would wish. So you should act as if you wish the employee to act. In other words, they didn't win the lottery when you hired them, no more so than you won the lottery when they accepted the job. So you need to act in a way that's consistent with what you'd like to see from them. Prepare them for success. Classroom versus field time. Again, I always love when I see people trying to train people on the tablet, right, during orientation. I'm like, they have absolutely, if they've never worked in EMS before, by the way, no one is going to be able to sit through a 2-hour tablet class or a 1-hour tablet class and be successful. You need to put your orientation and onboarding program into digestible pieces. You need to balance it between classroom and field time. And the other thing that I will say is, I do not understand why, when I look at orientation programs, 85% of the orientation content is tied to clinical medicine. These are individuals who have gone through an approved class, in most instances accredited classes. They've taken not only a test with the class or the program that they took, they then take a state and or national test, and then you probably even gave them a pre-hire clinical test. What in the heck are you going to teach them in the orientation class that they probably haven't already seen 10 or 100 times? The reality is only about 15% of the job is tied to clinical medicine. And the reality is the majority of that clinical medicine they're going to learn on the street. So your orientation program should be tied to succeeding in a job in EMS. That is far beyond anything that you're going to teach them clinically. There's a lot of aspects of the job that just don't have anything to do with clinical medicine. So balancing that out and making sure the orientation program should be on time. It should look like you've done this before. It should look like it is as important to you as actually you want it to be to them. In other words, make sure you invest the time and effort to have a professional level class. Make sure that image matters. Do not have people walking in the door. Do not have people, coming in late to the session, etc. Make sure it is prepared, organized, because they're drawing conclusions. It is a good indication We say the best predictor of future behavior is past behavior. This is a fabulous indication of what they can expect from you as an employer, is what they're going to see from you in the first few days. That being said, you should have regular check-ins after they leave your orientation or your formal, maybe say classroom aspects of the onboarding piece. You need to be checking in with them regularly. One of the software products that I developed actually has an indicator and a notification to supervisors and the employees to say, hey, you've hit your 15th day, or hey, Matt has hit his 15th day. You should check in with Matt. Matt has hit his 30th, 45th, 60th day, 180 day, right? They are interviewing you throughout the entire really first year. Frankly, they're interviewing all the time. But we know that turnover in the first year is roughly twice what it is normal in sort of normal EMS, which is already high. So your greatest investment in time and money are in the first year. And frankly, your greatest risk is within that first year. So you need to invest the time and the effort to make sure that those folks are adequately supported. By the way, it's not just how are they doing, it's how are we doing. That has to go on beyond 30 days. One of the things that I've said, and we implemented a program of career laddering at one of the services that I worked at, but what does it look like at your organization? I worked my way up into a director of operations or a CEO role, not because there was this clear, this clear line or path that was established by the company, like I would have seen at the fire department. I knew exactly how to become fire chief on my first day as firefighter. I knew exactly how to become police chief on my first day as a police officer. The fact of the matter is, in most EMS organizations, we throw people in, and it's sort of like, if we go back to the analogy of dating, right? Would you ever date someone who didn't paint a picture of what tomorrow might look like? I guess it would depend on what your motivation is. If your motivation is to find a partner lasting longer than a date or two, the fact of the matter is you'd want someone who had some hope, some picture of what the future with that person looked like. Again, you should have a delineated career path. It also provides you a whole bunch of financial benefits from the perspective of pay structures and steps. It also incentivizes employees to move up and ultimately will really truly benefit your organization. Clear path, even if it's outside of your organization. By the way, the best folks to promote your organization, aside from your own employees, are those who left your company but got there and were able to leave because of you. My wife, former EMT, now physician, talks very highly about the organizations that she worked for and what it's like to work in EMS. Those people, by the way, who no longer have an obligation to say nice things about you, they're incredibly persuasive for potential candidates. Employee testimonials, by the way, that's something that should be not only on your social media, but also on your website. If you are doing good stuff, your employees should be willing to talk about it. If you can't find anybody to do testimonials, you should take notice of that. And then, by the way, your supervisors are employees too. I used to have a boss who would come in and start hollering at us to get our reviews done for the year. And just for the record, I'm not a fan of annual reviews. I think, would you tolerate a dog that came home once a year, or a spouse that told you they loved you once a year? You probably wouldn't. Annual reviews are nonsense. But what I will say is your supervisors are employees too. You used to yell at us because we didn't have our reviews done on time, but none of us in the room had a review in God knows how long. What I would say is, remember, most morale problems start at the leadership level. Performance feedback models. Now, I have spent the last 6.5, 7 years researching specifically this, partly because of my work that I do with Newton 360. But what I will tell you is, have you ever had have you ever had a meaningful performance review? And if it's once a year, that's better than no times a year. But what I will say is, employees do not quit jobs or quit in companies where they are recognized often, receive feedback regularly, and have a relationship with their supervisor. Go back to Gallup. Number one thing that drives employee engagement is the relationship they have with that immediate supervisor. So you should have performance feedback or feedback. We can even get rid of the performance. You should have feedback models that not only go to the employee, but that also come back to you. They should be both annual and ongoing. In other words, when your employee sits down at the annual meeting, they should know exactly what you're going to say. You should know exactly what they're going to say, because you've built a feedback model. There's this great Harvard Business Review article that was issued back in October, I want to say 2016, it might have been 15, but I think it was 16, where they talked about Deloitte Consulting, the largest consulting firm in the world. At Deloitte, they used to say, and the premise of the article was they were wasting $5.5 billion a year on annual performance reviews, because they would get a crew together every year, they would meet, they would decide what criteria they were going to measure, they would then decide and develop and decide on the tool that they were going to use, and then they would send people out to do these annual reviews. They eventually abandoned their annual review process for a regular and ongoing feedback. They worked in teams of 6 to 8. The team lead at the end of every project, usually once a week or every other week, would fill out 4 questions on every team member. Did Scott do good work? Do you want to work with him again? Is he progressing? And would you move him up? And what they found after a year, and they are now, I think, in year 6 of this, they found every single performance metric of their teams changed dramatically and improved for the better. All right. So recognize what they found out was, geez, when our supervisors or when our team leaders give feedback on a more and regular ongoing basis, they actually get better at it. Number one. Number two, when they give feedback closer in time to the actual behavior, this goes straight back to Pavlov, right? You have an ability to impact performance when you closely in time tie the reward or the feedback to the actual performance. If you, right, ring a bell, but drop that bowl in front of that dog like a week later, the drooling that occurs when they know every time that bell is going to mean food will go away. So it's really important that you recognize that you need to have enough and be providing feedback. Now, I hear to folks, does this mean I have to give everybody a trophy? This is not about trophies. This is about recognizing and developing relationships. So again, 360 model, they should be able to give you feedback as well. And in fact, the best way to get employees bought in and committed and staying with your relationship and willing to accept the feedback you give them is to solicit feedback about how you're doing. And by the way, not getting ticked off if what they say is not very positive. Retention interviews. I have a lot of folks that say to me that they perform exit interviews. And so one of the challenges that I have with exit interviews are you're asking somebody who's already quit why they quit. I think it's important. But by the way, the message that you send to the people who stay is that you only are going to ask the opinions of those who quit. What is far more powerful is, tell me what keeps you here. Tell me why you stay. Tell me what you like about our organization. Tell me how, and what you, by the way, you also, again, can't get upset if they say, well, I'm only here for the money. Okay, well, that's interesting. You at least know one thing. There are people in your organization who, in fact, don't mind the, potentially the pay structure that you have. What is working or not working at your company? This is the kind of thing that, if, by the way, you are regularly asking, and I mean regularly, so every quarter, certainly more than once a year, you should be seeking or soliciting feedback from the folks who work for you, finding out what it is about the company. You can use those things as testimonials. You can use those things in your recruitment and retention efforts. And by the way, you can use it in changing or modifying the way that you interact with staff. So monitoring, measuring, as I've said to you all before, if you don't measure it, right, you can't manage it. And so you need to have that champion. You need to make sure that you are, in fact, looking at what your numbers are. If you're not sure what your turnover rate is right now, if you're not sure what, conversely, your retention rate or your time to hire, or all those things, understand that in most markets these days, if a candidate submits an application and they don't have a response within one day, they're going to disappear. So recognize that you need to be on top of that stuff. If something's not working, you have to fix it, and you have to fix it fast, right? Nothing kills a great employee like watching you tolerate a bad employee. Nothing kills a good process like tolerating processes that don't work. You should always be evolving and adjusting. So before I move into one of the other pieces that is in fact impacting recruitment and retention, I want to stop to see if folks have any questions.
I see no hands raised online. I don't see anything in the room.
Okay.
No.
Well, I know that I know that, you know, this is really a financial a seminar. And what I'll say is, this is the single biggest expense. This drives the single largest expense at any organization right now. If you can address the challenges tied around your recruitment and your retention, your organization will be more profitable. There's plenty of research going back again to that Gallup stuff. Organizations with high levels of employee engagement outperform by like 5 times organizations with lower levels of engagement. So the last and very controversial thing, what I will say is my opinion about vaccinations does not matter. All right, clear and simple. It just does not matter. What I'll tell you is, in a very pragmatic state, as you know, there have been 4 emergency temporary standards issued that are in fact impacting organizations and will potentially impact organizations financially. One of them was issued in June of 2021. It was the OSHA healthcare ETS. It applied to all EMS agencies, but really it was a settings-based ETS. So any healthcare-based setting was subject to the rules in the ETS, which required that you had a COVID coordinator who oversaw compliance with the ETS, that you had a policy that ensured that you could identify the vaccination status of every single employee at the organization, that policy, and that you maintained a log or a roster of employees and their vaccination status. Under that ETS, if employees refused to give you their vaccination status, you were to treat them as unvaccinated. Any employee who was unvaccinated had to be masked 100% of the time, unless they were in a room by themselves. That includes when they're sleeping in a bunk room. If they're in a bunk room with another person and they're unvaccinated, they must be masked. What I will tell you is, I'm not confident that all ambulance services are compliant with this. What I will say is, though, there have been numerous fines in the hundreds of thousands of dollars range from OSHA relative to this particular ETS. Because it's a setting-based ETS, it only applies to ambulance service. It only applies to employers of 100 or more employees, which I'm going to guess that many of the organizations here have, or some have less than 100. But it also, if you are subject to the healthcare ETS, any employee who's not in a healthcare setting, and there have been some lawyers who suggest that the ambulance station is a non-healthcare setting, but I would say that it's really a standalone administrative office, folks who are not regularly interacting with your care providers. Those individuals are, in fact, subject or not subject to the healthcare ETS, but will be subject to potentially other ones. There were, yep.
Go ahead.
Do you know, sir, from your experience as an attorney, I've always been under the impression that Colorado and other industries I've worked in the state, I've been told that we're a non-OSHA state and that
Nope.
we're not really governed by OSHA.
You are, actually, I've got the map right here on my wall. So
Okay.
yeah, Colorado is
I'm asking.
yeah. Colorado is an OSHA state, which means that you're covered or governed by OSHA. The difference is this: if you are a non-OSHA state, as it's commonly called, but what really is it's a state approved, an OSHA approved state plan. All right, so those are states who have decided to create their own plan and get it approved by OSHA. All right, those states, number one, so OSHA doesn't apply to governmental employers generally. All right, if you are in an OSHA approved state, you have an OSHA approved state plan. One, the state plan must minimally comply with any of the OSHA regulations. And number two, also covers governmental employers. So the downside for those who aren't an OSHA state is their state level plan covers more than OSHA does, and has to minimally provide at least what the OSHA regulations require. So Colorado, at least according to the OSHA map I'm looking at right now, is a federal OSHA state. So great question. There are 3 other ETSs that were released. The federal, what really was the Safer Workforce task force guidance for federal contractors relative to vaccination. That was released in September. That guidance said essentially, if you're a federal contractor or subcontractor, and that you must mandate vaccination for any employee who works on or in connection with the federal contract work. So if you have let's say you have a hospital VA contract, you're doing your VA contract to do transports out of a VA, or you are a FEMA contracted provider, subcontracted because your AMR is the contractor. If you are one of those, then your employees who do the work on or in connection with that contract must be vaccinated. That includes any employee working from home. All right. That being said, if you have employees who don't work on or in connection with, so on or in connection with includes dispatchers, it includes billers, if they're doing any work on or in connection with, all right, those folks have to be vaccinated. There is no provision for testing in the government and the federal contractor ETS. But there are exceptions. There are 2 permitted exceptions. Well, technically 3. One is, by the way, let me just say one other thing. If you are billing Medicare or Medicaid, that does not make you a federal contractor, okay? You have to have an actual contract with the federal government to perform services. So if you don't have that, just billing Medicare or Medicaid, or even getting reimbursed by the VA, but not under a contract, you're not a federal contractor. You don't need to worry about this particular ETS. Do those federal contracts apply to working with providing care for tribal entities? If that providing care for tribal entities occurs under a contract with the federal government, then yes. And I hope that answers the question, but happy to chat offline about that. So under the federal contractor ETS, what they say is you must be vaccinated, the employees must be vaccinated if they work on or in connection with. If there are 3 exceptions. One is the employee has a medical condition for which being vaccinated is contraindicated. So for example, I have an allergy to one of the things in the vaccination itself. That an allergy alone does not make you have a medical condition that's qualified under the ADA. So that's why I say there's 3. That's a separate group of folks. Then there is the person who has a medical disability or a medical condition that qualifies as a disability for which getting vaccinated is is recommended not by their doctor, or for those who have a sincerely held religious belief. Now, to be clear about what that means is, and by the way, these are 4 up on the screen here are comparison sheets amongst the 4 vaccinations. And I also have kind of a chart that I'm more than willing, Kim, if you want me to, I can send these to you after this. And what it does is allow folks to be able, yes?
Sure.
Oh, sorry, go ahead.
Yeah, Scott, I just want to go back to the OSHA and special districts. Because you mentioned most, OSHA doesn't cover governmental typically, unlike special districts. But then you said something else that made it sound like we did fall under that, and I didn't quite follow that. So
okay. Yep. Let me just, if your special district is if you are a governmental employee, all right. So in other words, you're a municipal, county, government employee, then you wouldn't be covered by federal OSHA.
Okay, thank you.
All right. That doesn't mean you might not be covered under some state requirement, but just so you're clear, if you're a governmental employee, you're not covered under federal OSHA. Go ahead, Kim.
One more question. What about SAMHSA contracts, grant contracts?
Grants. So it's interesting. They say federal contractors or subcontractors. They did not say grantees. So interesting, because like the federal Drug-Free Workplace Act applies to federal contractors and grantees. In this instance, they said federal contractors or subcontractors and did not mention grantees. Does that make sense? All right.
The questioner The questioner texted it from somewhere else. I don't even know where. it was.
That's great. Well, and I'll even double check that just to make sure that there isn't some other, information. Remember, all these things now, by the way, the federal Safer Task Force, that's a couple of months old, right? This isn't stuff that's been out there embedded for long periods of time. And as you well know, many of these are getting challenged in the courts. So, yep.
I attended a PWW webinar, and he definitely said, this is accurate as of 11 o'clock today, Wednesday. And
Steve and I have talked a lot over the last.
Yeah, he was very adamant that things are changing rapidly.
Yeah. So yeah, it is. And Steve and I talk, I hate to say it, like we're talking 3 or 4 times a week now. Although I don't say it because he's a fantastic guy. Actually, all those folks are. So although I guess technically we compete, but I like him a lot. So in any event, what I'll say is, yeah, you're right. Things are changing rapidly. I think the federal contractor ETS is on pretty solid legal ground. But that being said, you as an organization have to have a policy about folks seeking exemptions, and you should have a process. I have sample forms. I'm more than willing to share with any of you. The form is designed so that you can just plug your logo into it and run off. All right. That being said, you should have a process. One, you need to have a policy. You should have a process. You should have a log. All of this stuff I have, and Kim, I'll send it to you after this. What I will also say is you should, and I have helped a lot of ambulance services with going through reasonable accommodation meetings. In 18 years of practicing law and additional 11 years of being a manager, I only ever, prior to 60 days ago, only ever did 3 reasonable accommodation meetings for religion. In the last 60 days, I've done 60. So, by the way, the world's getting nicer because we have a lot of religious people. So what I'll say is the world is going to get better. That's tongue in cheek. All right. So mandatory vaccinations, impacts on recruitment and retention. Certainly the questions come up. Oh, well, let me just touch quickly. The OSHA ETS could apply to some EMS individuals. Anybody who's a care provider, that wouldn't apply to because you're covered under the healthcare ETS, which oddly does not require vaccination. The OSHA ETS is currently being stayed by due to a case in the Fifth Circuit. OSHA has said they're going to hold off on implementation. We'll wait and see what the Supreme Court says. The CMS ETS does not apply to ambulance providers. All right, I've heard a lot of people say, oh, this one applies to us. It doesn't. It applies to certified healthcare facilities who are subject to conditions of participation or conditions for funding. All right, what I would say is those, they don't apply to ambulances, but it does require that those entities ensure that any employee of a contractor or vendor performing services and interacting with the employees of that facility or their patients must be vaccinated. There is no testing option under the CMS vaccination ETS either. The only testing option was under the OSHA one, which is currently stayed. So same thing with the CMS ETS. You have to have proof of vaccination. You have to have a roster of everyone's vaccination status. You may, evaluate exceptions. Those exceptions are for the medical condition or for religion, sincerely held religious belief. You should have a policy. You should have a practice and forms. Again, I don't think the federal government should be in the business of mandating vaccinations. I'll tell you right out, even though I support vaccination, I don't think it's the federal government. I think that is a states' right issue. And I think, frankly, the OSHA case will be successful. The CMS case, they argue some things around the Administrative Procedures Act and not doing notice and comment. And honestly, I think CMS is well within its authority to mandate vaccination. If you haven't heard from your contracted facilities, good. It doesn't, you're not going to get fined by CMS because you're not subject to the ETS. They are. Go ahead, Kim.
So if there's a written contract quite often for an ambulance service to do interfacility, non-emergency transports.
Yep.
If you routinely deliver 911 to the only facility in the area, is there an implicit contract?
No, nope. But here's what I'll tell you. The ETS for CMS gives the facility the right to expand the individuals that they can require to be subject to vaccination. They have the right to. Now, arguably, understand, you feed them. That if you don't have an actual contract to furnish services, technically, they're not obligated to make sure that your folks are vaccinated. All right. What I will tell you is they may say, we want to evaluate anybody seeking an exception. I would never let them do that. I would simply say, we can furnish you with a letter assuring you that we're following the guidelines relative, even though we're not subject to it, or subject to it because you are. We understand, we've sought legal counsel, and we will evaluate the accommodations, because honestly, I've had this happen. They've said like, no, we're going to do it. I'd say no way. Because if they decline an accommodation for someone that you as an employer should have accepted, you're on the hook, not them. So, and on top of it, they don't have a right to know the private medical and or religious information of your employees. They may fight you on it, but I'll come to bat and get on any phone call with any one of you happily for free, unless it's like, like 6 hours, but like, let's be reasonable, but I'll do it and just say, I disagree with their assessment. They are obligated, but there's no specific language that says what they have to do in order to ensure that. And if you're contracted with them, they can build it into the contract. That's fine. All right. So just recognize, again, the only acceptable documentation for vaccination are those really official forms, either your state registry. They cannot simply sign an attestation saying I'm vaccinated. It doesn't work. Just so you know, I was able to purchase a vaccination exemption card.
Wow.
They cite 2 federal regulations on this card, neither of which have anything to do with vaccination. I also got this handy dandy written script that says Scott, from a doctor in Tennessee, that says Scott should not get vaccinated due to his medical issues. My medical issues that I provided, I'm afraid of needles. That's it. So just know, all right, that by the way, I think that doctor has actually been censured by the Tennessee board. Dr. Kramer from NHTSA wanted a copy of my card. Some employee presented this to one of my clients. I went online, I applied for one just to see if there was anything to it. Cost me $148. But honestly, by the way, the 2 CFRs, one is the CFR related to the HIPAA regulations for the ability for a covered entity to share protected health information with public health officials, nothing to do with vaccination. The second one is the regulation relative to service animals, that the dog or the animal gets to go wherever the person gets to go. Nothing to do with vaccination. It's just total hogwash, but it does look awfully official and signed by a doctor. You have the right to demand that the person has a relationship with the physician and that the physician is recommending no vaccination. But if anybody has any struggles with reasonable accommodations, I will help you. I will not, if we're talking more than an hour or 2, then we'd have to talk. But honestly, I'll help you because I know this is really tough stuff. I know I'm from Northeast. That doesn't mean I'm a liberal. Here's what I'll tell you is, I don't think the government should be in the business of telling people to get vaccinated. That being said, I think people should have the good sense to go get vaccinated. But no one cares what my opinion is. What they want is for me to help them in a legal perspective. And I'm happy to do that. What I will say, make sure you have those policies. I will send them to you, Kim, as soon as this ends, I'll send you all of those documents. What I ask you folks to do is if somebody asks you for them, please send them to me and I'll be more than happy to furnish them to them, but don't proliferate the hell out of them, because I'm more than happy anybody who's on the webinar, and certainly there are copyright stuff on there, but the goal is that it makes it easy for you to get through this process. And again, as I said in the first session, if you sat through any of my sessions, the least I can do is answer a question for you, because you all have shown me the courtesy. Just quickly, the CMS one, two groups have filed suits. One is a 10-state group being spearheaded by Missouri. The other is a 12-state group being spearheaded by Montana's AG. I don't know what will happen with those cases. I think the OSHA one will never see the light of day. I think that one is dead in the water, because the only time OSHA has the right to make an emergency temporary standard is when there exists a grave danger for which they must act expeditiously and ignore the Administrative Procedures Act, which requires notice and comment. Well, the question is, and this is a great argument made by the plaintiffs in this case, if in fact there's such a grave condition, did it not exist back in February when vaccinations were available and COVID was rampant? So the argument fails right then and there. And so as such, they probably should have gone through the notice and comment period. So with that, questions? And I know this was sort of a non-traditional financial discussion, but I promise you, this is your biggest financial challenge. And here's what I will also say is if in between the time that I'm able to send these things out to Kim, you want them, or if you have employees who you need assistance with, by the way, we're nice to everybody. Reasonable people have the right to disagree. And in fact, I had a new client request this morning from someone who's like, I don't agree with your stance on vaccination because he doesn't want to get vaccinated. And I'm like, that's okay. You're right to. I'll defend your right for that all the way to court. So if you need anything or you need assistance, don't hesitate to ask for it. This is, like I said, it's a lot for any one person to do. But this is all I do. I don't run a service anymore. So questions, any other questions?
I don't see any questions online. Scott, any questions in the room? Looking pretty quiet in here. I think you've kind of given everybody a lot to think about. Appreciate your efforts today very much.
Well, sorry, it wasn't a more traditional financial.
Oh,
Next time we can do rev cycle management. That's easy.
There you go.
Yeah.
Scott, thank you so much. And we'll get with you the next time and hope, great info. Thank you from Gail up in
Yeah,
Summit.
thank you.
So,
Well, I can't thank you guys enough. I really enjoyed this group in particular, and now Shirley all the time as well. It makes me smile to see you guys. And again, I come from a really small town of 6,000, so I know it's not easy to run, EMS agencies, but I'm just grateful and appreciative of the time. And again, when I offer assistance, I mean it. So please don't hesitate to take me up.
very good. Thank you, Scott.
Thanks, guys. I
Appreciate
really
it.
appreciate it. Take care. Bye-bye.